Okay, we're continuing with this book here, The Cancer Resolution by Mark Lintern. We're covering pages 205 to 237 today. He mentions that some research suggests that fungal infections might sometimes cause Parkinson's disease and multiple sclerosis. Now, I haven't heard that before, but I know that there are more than one thing that can cause Parkinson's and multiple sclerosis. I've previously given lectures about teeth and how dental amalgam mercury is thought to be a cause of multiple sclerosis and of Parkinson's disease. What he thinks is happening with fungal infections is that fungal infections, in a sense, are kind of saprophytic. When a cell is weakened and damaged, they sometimes can then invade it. I think that's part of what's going on. And that's part of what his cancer theory is that a cell's weakened, for example, by hypoxia or toxic chemicals, and then the fungus can secondarily infect it and live inside the cell, become intracellular. He says the oral fungal microflora of oral squamous cell carcinoma, oral cancer, patients is remarkably different from healthy individuals. The fungal burden and diversity of yeasts were significantly higher in the patients with oral tumors compared to the oral cavity of healthy people. In this study, we have shown that oral candidiasis infection indeed aids tumor progression, thus applying treatment, I'm going to get myself out of the way, with antifungals simultaneously with chemotherapy might be recommended in this cohort. However, here's the problem. And again, I got page numbers for all of this, so if you ever want to buy the book, you can see my page numbers to go along with it. Okay, he says, generally speaking, cellular life is usually prokaryotes like bacteria or eukaryotes, other cells, and that means they have nuclei and mitochondria like in plants, animals, humans, and fungi. But the main difficulty is that there's a lot of similarity between other eukaryotes like fungi and humans, so it's hard to come up with a drug that effectively treats the fungus and doesn't affect the human, or not significantly. So he's basically saying there can be a lot of side effects with antifungal drugs. Currently, antifungal agents are toxic, and resistance to these agents is becoming an increasing problem. One example of this here, let me shrink myself some more. One example of this comes from the common fungal pathogen called Cryptococcus neoformans. This intracellular, that's a key word, it's inside the cell, intracellular pathogen, is so adept at invading and controlling human cells that it's even able to survive within immune cells. So it can even invade your immune system cells and lay dormant in them until conditions favor infection. Because I've heard of other invading microorganisms. They can sense even when your cortisol level is high, so you're immunosuppressed, and then they'll cause an active infection. Okay, like I've heard that's what like herpes cold sore can do, and I've heard that's what some other infections can do. It's almost like they have an intelligence to sense when the immune system is weak. Okay, the causative agent Cryptococcus neoformans has remarkable ability to hide and proliferate within phagocytic cells of the immune system. This intracellular phase is thought to underlie the ability of the pathogen to remain latent for long periods of time within infected individuals. We know in the blood you can have dormant bacteria that get activated when there's an elevation of free iron. Okay, he continues. In fact, this study highlights something extremely interesting. This intracellular fungal pathogen is capable of transferring from one cell to another while remaining intracellular. I know there's certain types of bridges between cells through which mitochondria can go, and now I'm learning here that fungi can do it as well. This allows them to avoid immune detection and highlights their ability to infiltrate tissue and turn infectious only when conditions become favorable. Many common antifungal drugs are shown to be effective against a broad range of cancers, strongly indicating that fungal pathogens are the microorganisms that have a primary influence over the disease. The type of infection that I propose develops into cancer is one that is opportunistic, confined to a small area of damage, inflammation, stealthy and slow, which is more reminiscent of a fungal infection. So yeah, like I'm saying, it's saprophytic in the sense that it finds weakened tissue and perhaps hypoxic, thus with dysfunctional mitochondria, and then it can invade it. Fungi were detected in all tumor types among 35 different types of cancer that were studied, including their specific profile. Similar to bacteria, fungi were visualized in both cancer and immune cells. We found interesting fungal bacterial immune cell associations. In addition, we found specific fungi to be associated with different clinical outcomes. Most fungi were intracellular in cancer cells and in immune cells. Okay, so that's a little scary. What that says to me is You want to optimize your immune system function, because in the end, the immune system either wins or loses, and you want it to win, because it's going to have to deal with things sooner or later. So you want optimal functioning immune system. That's why you don't want to be half-assed on your diet and lifestyle, because you want your immune system to have that extra ability to control the fungal infection. And like I tell you, I look at old people, young people, their CAT scans of their head, neck, chest, and abdomen and pelvis, and the young people have more robust lymph nodes. It's especially obvious in the neck, and that's a sign of a healthy immune system. Okay, but there's a difference between healthy, normal-looking lymph nodes and abnormally enlarged lymph nodes. But I just mean in general, they have an obviously more robust immune system than an older person. So that's it for today. I hope you found that helpful.